Good morning. In today's video, I will be talking about hemophilia, which is basically a genetic disease. It is an X-linked recessive disease that has further three subtypes, hemophilia A, B, and C. Now, hemophilia A is the most common and it is caused by a deficiency in clotting factor 8. Likewise, hemophilia B is caused by the deficiency in clotting factor 9 and hemophilia C is caused by deficiency in clotting factor 11. Now, the unique thing about hemophilia C is that it can affect both males and females equally. Now, if we come about the pattern of inheritance, I told you it is an X-linked recessive pattern. So what do I mean by this? I mean that males have a more probability or likelihood of being inherited from hemophilia A. Now, what is the reason? The reason is that we know that males have X and Y allele. So even if one allele of X is being transmitted from the mother to them, they will inherit the disease. However, in the case of females, since their chromosomal pattern consists of two X, they will have to basically inherit both of the alleles. Now, the predominant symptoms which result in hemophilia are spontaneous bleeding without any sort of injury or cut or any external stimuli. Naturally, because of the immune system, there is inflammation in the body and the body tries to protect itself. So there is joint pain and swelling because of the release of interferons and tumor necrosis, TNF alpha. Now, how do we diagnose this disease? Since this is a genetic disease, it is diagnosed by measuring the clotting factor levels, which are decreased. I mentioned you before that in each of the following hemophilia A, B, and C, either factor 8, factor 9, or factor 11 is basically is depleted. Now, if we come to the treatment, naturally, if the clotting factors are decreased or basically they are diminished, what So, as I was talking about the treatment, what do we need to do? We need to give the person antifibrinolytics, which will prevent the clots from breaking down, as well as giving them intravenous infusions to basically replenish the amount of blood which has been lost. And often in these patients, they also develop microcytic hypochromic anemia because of the deficiency of hemoglobin. Now, I've already talked about the complications, which are joint damage and infection. Thank you.